I'm Mary Phan-Gruber. I'm the CEO of Jefferson Regional Foundation. The foundation was created when Jefferson Hospital became part of Allegheny Health Network, was funded in that process, and so we have a mission to do community grant making, education and outreach, and we've been able to distribute over $19 million in grants to nonprofit and civic groups in this area that Jefferson has traditionally served. So because of our legacy, we are a health-focused foundation, but that's a very broad community health focus. So we don't fund health care, but we fund a variety of priorities that relate to that. So everything from diversity, equity, and inclusion to workforce, civic engagement, early childhood, children and youth, capacity building, health and wellness. The foundation has always really tried to understand community needs in a variety of ways. So we have a collaborative that has over 100 members, nonprofits in the area, including MVI, for example, a lot of those partners who are on the ground understanding what they're hearing. We've also done activities like Around the Table South, which was a community conversation with 1,000 people. And we try to, we have a board that is representative of the community, so they're very close. They are residents, some of them work in the community as well and have businesses. So there's a lot of input that is part of that process. So the social determinants of health are very important and a focus of what we do. And it really is built on the idea that where people live, work, and play has a big influence on their health. If someone lives in certain communities, the mortality rates actually vary wildly. So where you live may have a bigger impact on your health than your genes. We look at all the aspects of the neighborhoods that people live in, how healthy those are, the air that they breathe, the access that they have to safe places to live and work and play. Equity is a really huge part of the social determinants of health because there are existing disparities and inequities that we know are there that have to be addressed just for people to be able to access services or be aware of services or receive programming at the same levels. So all of us have to be much more aware of and make extra efforts to be inclusive, to listen to community voices, to find new strategies and outreach, to partner with groups who don't receive as many resources as we have. So we've really made, and our board has made, an extra effort to look for those kinds of groups, partner with them, fund them, support them, and increasingly we've seen that growth in our collaborative as well. Workforce is a big piece of increasingly of our work, and MVI has been a big partner in that work. Increasingly, we've seen that workforce is an incredible part of someone's health and a family's health. Being a social worker has meant that I've been able to engage in a variety of career moves, exciting things, but my work has really been focused on the nonprofit sector throughout my career. It's been tremendously exciting to come to Jefferson for the last part of my career before I retire and really build out the possibilities here for these communities and really build the identity here. Jefferson Regional Foundation's been able to grow because we've had a supportive board. We have always emphasized the other parts of funding. So as a foundation, people sometimes think first of the money and the dollars and the financial support, but we have always also emphasized the other ways that we can build capacity, build skill in the community, gather and convene organizations. Some things that are takeaways for the Mon Valley are just the sense of pride that people have in the Mon Valley and the sense of deep history there that is a little different from other parts of the community. There's also certainly a sense of being ignored sometimes, and viewed as not necessarily an asset. There are tremendous assets in the Mon Valley that are yet to be really built on and explored, and I think the future is very bright for the Mon Valley. Retirement is always a little bittersweet when you're leaving an organization that you think is so impactful and has such opportunity, but that's also the sweet part of it, is that leaving while there's a lot of things to look forward to. I'm really excited about being able to do the next part of my journey, and I think this organization will continue to thrive. There's a great staff and a great team and a great board and great new offices. I'm very excited about our successor, Tricia Gadsden, who has wonderful roots in the Mon Valley, and her family has long-time roots in the Mon Valley, and particularly in McKeesport. Dr. Gadsden has a history of also being really close to community, of listening to a variety of voices and making all that count. She will continue that legacy. I'd like to be sure to shout out to MVI, to Laura, to Joey Lynn, to the team. MVI has been a fabulous partner for Jefferson Regional Foundation increasingly over the years and will continue to be. I was surprised and very, very pleased to have this award presented. So I'm so pleased that this is part of my how I'm finishing out my time at Jefferson Regional Foundation. It's very fitting. At Jefferson, we couldn't have done the things we've done without our board, our tremendous staff, all of our tremendous partners and grantees. The secret of the foundation world is that we're not really doing the work, everyone else is. And sometimes we get the credit, but truly it's a joy. We're inspired every day by what people do.